Let's watch a short video before we begin. Thanks for coming out of your busy schedule. It is a great honor to present at the 2024 MegaMind. I'm Dr. Jung Ju Kim, and I've completed my periodontal residency at Seoul National University Dental Hospital. And currently, I'm the owner dentist at the Meister Dental Clinic in Seoul. Today, I'll be discussing the factors affecting the long-term stability of implants, along with surgical methods that I've personally developed. In our body, all organs are covered with skin and mucosa. However, tooth is the only organ that connects the inside and outside of the body. Therefore, missing tooth means a hole in the body. Implant replaces this missing tooth, so sealing the hole in the body. Implant is exposed to numerous oral bacteria. If these bacteria penetrate the bone, they can cause bone loss around the implant, leading to implant failure. Therefore, it is crucial to prevent bacteria from entering the bone to ensure longevity of implants, which means soft tissue around the abutment plays a crucial role. This soft tissue barrier is called mucosal seal. A healthy mucosal seal is the key to the long-term stability of implants. The mucosal seal is maintained by the attached gingiva, which resists the movement of surrounding tissues. On the left, you can see the well-maintained bone-attached gingiva preventing cheek movement. However, on the right, insufficient attached gingiva makes the mucosal seal unstable and detached, allowing bacteria to enter. Bone-attached gingiva is especially crucial in maintaining this stability. I wrote this paper as the first author, which was published in Materials in 2020. It examines the responses of peri-implant tissue around abutment. First, we compared the surrounding tissues of natural teeth and implants. Unlike natural teeth, implants have no dentogingival fiber, resulting in weaker attachment of abutment to the gingiva. We categorize the attached gingiva of implant into two types. First, the weaker abutment attached gingiva because of the absence of dentogingival fiber, and the stronger bone-attached gingiva. The bone-attached gingiva is crucial for maintaining the mucosal seal. As shown schematically, bone-attached gingiva must remain stable in order to withstand the movement of surrounding tissues, thereby maintaining the mucosal seal. Let me quickly share a case. The healing abutment has been removed in order to connect the final abutment. We only find a weak abutment attached gingiva above mucosa. The absence of bone-attached gingiva makes the mucosal seal unstable, so I performed free gingival graft on the alveolar bone, and we can see the newly formed bone-attached gingiva between abutment-attached gingiva and mucosa. This strong bone-attached gingiva will prevent detachment of mucosal seal from the movement of surrounding tissues. Now I'll show you the first case. One of the main methods to gain bone-attached gingiva is free gingival graft. When placing the implant to replace the ponic, we observe very little attached gingiva. when you remove the bridge, we can see the loss of attached gingiva along with lingual expansion of mucosa. Now we extract tooth number 47 and make an incision for an apically positioned flap at the side of tooth number 46. Following the placement of this fixture, we position the flap apically and then place the fixture. We harvest FGG from the palate and suture it to the buccal site. Then we create a new incision below the graft to induce a scar tissue line formation. Now this is the healed state. And here's the panoramic X-ray. Compared to the initial state, you can see that the mucosa under the ponic is positioned more apically, gaining bone-attached gingiva. Here are the pre and post photos showing the healing state following the surgery. The scar tissue line is well formed, and the newly formed bone-attached gingiva and scar tissue line protect mucosal seal from cheek movement. And we induce sink down procedure through provisional crown, and here is the final restoration. And this is about 1 year follow-up photo. Before and 1 year follow-up photos show a well-maintained buccal bone-attached gingiva. And now I'd like to introduce another method of gaining bone-attached gingiva. We can observe peri-implantitis on this implant with external connection type. You can see the crown mobility due to screw loosening. Crown mobility induces mucosal seal detachment, oral bacteria penetration, and peri-implantitis. When removing the crown, we can observe the significant wear of hex inner part and the fracture in the fixture as well. Rather than immediately removing the fixture, I'll show you how to utilize the abundant attached gingiva on the lingual side. First, we remove the crown and abutment, then make an incision on the sound bone of the lingual side. Next, carefully elevate the gingiva on the core and fixture area to shift the flap buccally. Then use a trephine drill to remove this external tie fixture. And then place a new fixture slightly mesio-lingual than before. Here is the new internal connection tie fixture. Now we position the pedicle flap buccally. To prevent shifting back to the lingual side, we use a slightly taller healing abutment. This surgical method induces good bone fill from below and abundant attached gingiva on the buccal side. Here's the panoramic comparison. I prefer place to mandibular molar implants slightly upright in line with occlusal forces. The before and after photos show a slightly thicker attached gingiva on the buccal side and final abutment connection. And this is the provisional crown was set. And here's the final restoration. Compared to the initial state, a slightly thicker attached gingiva can be seen on the buccal side. And this is the 2 years follow-up photo. The bone attached gingiva is well maintained. So far, I've shared cases on gaining attached gingiva using FGG and lingual pedicle flaps. And now I'd like to share a case where both methods were used together in combination. Here we can see a fixture with broken abutment screw under the ponic, and the periodontal condition of abutment are poor, so we remove the bridge and plan an incision for lingual pedicle flap to gain more attached gingiva on the buccal side. Extract the abutment and use a trephine drill to remove this fixture. Place the fixture and shift the flap buccally, then suture it up. Here is the panoramic X-ray, and this follow-up photo shows the well-healed buccal attached gingiva. However, at this site, there is no vestibule and no attached gingiva. And so, the cheek movement directly affects the implant, exerting detaching force on the mucosal seal. Here's my answer to the situation. We perform vestibuloplasty and FGG simultaneously, referencing and modifying the Adelman-Mayhart technique. First, we make an incision in this direction to create a partial thickness flap. Then we use a periosteal elevator to elevate a full thickness flap, filling the bone as we go downward. We position the flap in this direction, placing it as so. After removing the healing abutment, we remove the epithelium by partial thickness flap. Next, we harvest FGG from palate and insert healing abutment into it, then connect it to the fixture and suture it up. Schematically, this is how vestibuloplasty and FGG are performed simultaneously. Here are the pre and post-op photos. This is the state at the time of stitch out. You can see the newly formed bone-attached gingiva and defined vestibule. It's beautiful state. And here is the photo of final abutment. You can see the healed tissues. It is like seeing the evolution from Iron Man's old bulky, uncomfortable MK1 suit to the highly flexible MK50 nanosuit. In this video comparison, vestibuloplasty and FGG are well performed. We carefully crafted the provisional bridge by hand and used it for about 2 months, and this is the final restoration. And here is the panoramic comparison. This is the final result. To summarize, the long-term stability of implant is achieved through a healthy mucosal seal. The mucosal seal is maintained by the attached gingiva, especially bone-attached gingiva. And these are the surgical methods to gain bone-attached gingiva. And it prevents the detachment of mucosal seal from the movements of surrounding tissues. Thank you for your attention. I hope this presentation helped you understand the importance of bone-attached gingiva in long-term stability of implant. Thank you.